Good evening, ladies. Welcome to Wellness Wednesday. I hope everybody's doing great. I hope you like the Christmas timer. I thought that was kind of fun. Anyway, we are going to give ladies just a few minutes to who want to hop on, just a couple minutes here, and then we will get going. I can go ahead and say my disclaimer while we're getting going and waiting for anyone else who wants to jump on. So anything that I say tonight is just health advice. It's not health advice. It's just health information and not health advice. Do not start taking or stop taking or change the way you're taking any of your medications. And if you feel like you need to, please consult first with your prescribing practitioner so that they can make the appropriate adjustments with you. And finally, by attending this Wellness Wednesday, this does not establish a doctor-patient relationship. Okay. Well, I am really excited to be with you, ladies, this evening. This is an important topic. Probably at least 50% of my patients deal with arthritis and joint pains, and we're going to go through basically what causes this, and we'll let's define it. Let's kind of talk about what defines it, and then certainly look at some ways to evaluate and get this, under control. So yes, 50% at least of my patients deal with arthritis or joint pain. Where is it? Is it, is the location? Is it large joints? Is it in small joints? So a lot of times I'll get sorry, just drank a bubbly drink, and so excuse me. Small joints, fingers, toes, large joints, elbows, shoulders, hips, and you want to pay attention to what it's like. Is the pain achy? And it often is. It's often very achy. And it's often, accompanied by stiffness that is worse when you move from a resting position. And certainly joint pain can be sharp, but that would be fairly rare, and that would be probably the most concerning if there's real sharp pains when you move a joint. Joint pain can be migrating or transient, so it can move around. That's what I mean by migrating. And there are certain things, and I'll discuss this later, that this can be indicative of. Or it could be chronic. It can just be all the time, whether it's worse at some time, during some portions of the day, and better some portions of the day, but it's just always there. Joint pain certainly can be associated with other symptoms like swelling and nodules, deformities even. A lot of folks with rheumatoid arthritis, so autoimmune arthritis can develop deformities. And so we've got several ways to describe this, and so you can kind of key into what's going on. Like I said, most of the time, this is, it's just uncomfortable, and it's sometimes it gets to be unbearable. For some, it's just a nuisance, right? Okay, so what are some of the causes of joint pain and arthritis? So certainly traumas, right? Accidents, physical causes of joint pains. We can then think about everyday but repetitive movements can certainly tax certain joints. Some of you are familiar with a term called osteoarthritis. Doctors will usually tell you that it's, say from using a mouse too much, there's going to be joint pain here in your fingers. Um, underlying things can also affect muscles, underlying toxicities and disorders which cause muscle tightness, which cause muscle tension. One thing to remember is it's muscles that pull bones and joints, so pull bones into joints. And so if you have muscle tension from some cause, and I'll kind of get into that, then that's going to pull on the bones, and the joints are there in the middle, right? So muscles move your joints. So it makes sense that muscles can, muscle issues can cause joint pains as well. So inflammation can certainly cause joint pain. So we've got inflammation that is caused by infections, by foods, by toxins and toxicants. Toxicants are usually, I'm referring to chemicals that you might be exposed to. Heavy metals can cause inflammation and joint pain. Leaky gut is a huge, huge cause of joint pain, which happens because of immune complexes. So when undigested particles leak into the bloodstream and cause an immediate immune response, an immune complex, these immune complexes will just circulate through your tissues and deposit in your joints. Autoimmunity certainly can cause joint pains, but what causes autoimmunity? Inflammation. So we dig a little deeper, but certainly HLA positive conditions like ankylosing spondylosis can cause spinal joint pains, rheumatoid arthritis, and there's certainly some other forms, psoriatic arthritis, which are, they're both autoimmune issues. These cause the destruction of your joint cells, and so there you have it. The joint cells that produce the fluid, the synovial fluid, that's going to contribute very much toward joint pains, and certainly infections, viruses can lead to joint achiness. Usually this is transient, but I have seen cases where you have chronic joint pain because of viruses. Excuse me. Bacterial infections. Lyme is a really interesting and common cause of joint pains. So Lyme, and this, one of the hallmarks of Lyme-caused joint pains is migrating joint pains, where it tends to move around your body. And so this is caused by the Borrelia bacteria toxin that these tend to settle in joints. Co-infections with Lyme include Bartonella, which is cat scratch disease, and Bartonella is another bacteria. So this can be also a pretty common cause of joint pain, migratory joint pain. Babesia, parasites. So parasites is another kind, a cause for joint pains. Babesia is one of those that also tends to come along with Lyme in a tick bite or a mosquito bite, and that can also cause joint pains. I want to mention gout now as one of the oldest known causes of joint pain. And I want to spend a little time here because this is really interesting. I'm going to sneeze. Okay, bless me. Okay, so gout. Gout is a it's like I said, it's one of the oldest known causes. It's like the oldest named cause of joint pain and arthritis. Usually, it affects one major joint. A lot of times, it's the joint of the big toe, the big joint of the big toe. It can affect elbows. It can affect knees. It can affect ankles. But this is caused by buildup of, and it's so painful. This is where you're really sharp, really bad throbbing, and very, very tender joint pain occurs. It's so tender that, if it's in your toe, you couldn't even tolerate the sheet on your bed touching your toe. I mean, it's so painful. This is caused by a buildup of monosodium urate crystals in those joints. So uric acid, this is caused by an increase in uric acid. Most mammals have the ability to break down purine amino acids and get rid of them, like waste them through the urine. But as humans, we tend to only be able, and it's certain breakdown products of uric acid that mammals are able to produce. Well, humans don't really have this. They're really only mammals that really don't have the ability to break uric acid down. And so either we excrete it through the kidneys, or it builds up in the blood. And there are several things that this causes. So this can lead to hypertension or high blood pressure, kidney disease, metabolic syndrome, because these crystals, they're inflammatory, and or this acid, I should say, the uric acid is inflammatory, so it causes this inflammation, which causes the blood vessels to be inflamed, which will increase your blood pressure. It causes oxidative damage, so especially in the kidneys, those kidney cells are very vulnerable to oxidative stress. I should have said on the high blood pressure, this uric acid directly affects the endothelial cells, or the cells that line your blood vessels. So it causes them to be damaged, and this can lead to heart attacks and strokes. Well, what causes increased uric acid? Fructose. Okay, so when you have a fructose problem, or you're eating too much fructose, like too much sugar, this will potentially lead to, well, it will increase uric acid and potentially lead to gout. One of the interesting things is that this affects, gout affects certain amino acids, and this, it's so crazy how this all works together. But glyphosate is an amino acid analog, glycine analog, or in other words, it's very much like glycine, the amino acid glycine. And this is found in so many different enzymes. And so when you can't break this down, this starts to this starts to be a real problem. When your body breaks this glyphosate down, this produces some other chemicals that are not very good for our bodies. So there's just so many effects of so many ways that our metabolism can be affected, and purine breakdown, the certain amino acids called purines breaking down and ending up as too much uric acid will cause metabolic dysfunction. So we wonder why we have decreased energy or trouble dropping weight when our metabolism isn't functioning. And we need to consider checking for some of these things. So your arthritis can be yet another sign that you have metabolic dysfunction. Anyway, so let's talk about how to test for this. comprehensive testing is the only way we'll be able to figure out what's causing arthritis. So certainly you can rule out some causes by going to the chiropractor, or I want to mention specifically, if you have larger joint pains, you're better off starting with something like that. Someone who does body work, someone who does chiropractic someone who does FDM, fascial distortion model and evaluation. So doctors can do that are trained in that. Physical therapists, I know there's some physical therapy groups around, clinics around here who specialize in this this certain technique. And this type of work, the treatments that this offers can fix this joint pain 80% of the time. I mean, it's pretty phenomenal. I should say up to 80% of the time. And so if you have joint pain, I'm sure many of you who are dealing with this have sought that kind of care out. But like I said, when it's a large joint, that's probably the first thing that you want to try or want to entertain is that sort of evaluation. And I've talked about this in a previous Wellness Wednesday, but it is important to find out if there's a structural abnormality, because structure certainly does affect function. Okay, so comprehensive testing, let me get back to that, will help us figure out if there's inflammation, underlying infection, autoimmunity, increased uric acid, and so we've got to use that tool, that comprehensive testing tool, to really figure this out. And once again, the joint pain itself, the arthritis, or if it's just like singular joint pain, this can be a signal to us that something is imbalanced. So we really just need to get comprehensive testing to figure that out, and someone who knows how to evaluate that properly and put it together. Okay, certainly you can evaluate joint pains and things with X-ray. It certainly has its pros and cons, and so X-rays can show if there's dislocations, or if there's a lack of cartilage. But frankly, I've seen a lot of folks with really bad-looking X-rays who don't have a lot of pain, or any pain. So they could be bone on bone in their knees, and they're like, "Well, doc, I don't have any pain." And we had probably got the X-ray for another reason. Well, even if you get the X-ray and you find that that there's something wrong, that there's arthritis, shouldn't we seek to see if there's something deeper going on? MRIs, excuse me, those can be useful too, but sometimes they really can't, fully elucidate the problem either. It can certainly show us if there are structural problems in especially in larger joint pain issues, where maybe you've had some body work done. Maybe you've had a chiropractic evaluation, and you've had treatment, and it just doesn't seem to help. And so maybe from there, because you're not getting better, or you've got severe limitation, maybe you've then got to get an MRI and really get to the bottom of the structural issue, if there is one. Well, what if there isn't? Then you need comprehensive testing. Okay. So I want to talk about a couple of cases. So I want to tell you a success story with Patty. She was dealing with a lot of hand pain and neck pain and shoulder pain, and what else? seems like there was something else, like either hip or knee pains. But she got the comprehensive testing, and she went through a comprehensive care program that was customized to her. And within just a few months, her joint pain had diminished almost to nothing. Along with the other goals she reached her other health goals as well, got off many, actually all of her medications, and was able to get her weight down to where she had hoped she would get it down to. And then, her energy was so much better. So, and her brain fog improved. So there's so many, I just wanted to mention her case because she had significant arthritis pain. Okay. I also want to talk about Joanne. Now, Joanne's joint pain, she had a lot of finger joint pain, and started to have deformities and a lot of swelling and stiffness. And to her, joy and amazement, her joint pain has subsided significantly. It's almost gone. And the stiffness, she said, is not there anymore. She can move her fingers. And this was at a point where she was starting to see some of those deformities and some of those nodules and things. And she improved because she improved her inflammation. She was able to find the root causes for her inflammation. And so there you have it. She's doing so well, and she's doing so well in so many other ways. So it's just fun to talk about these these successes that our patients are having. So to recap, ladies, the majority of our patients suffer from joint pain and arthritis. It can happen in multiple locations. It really matters where and if it's constant, if it's migratory, if it's transient. It's important to get all this information as we assess it. And there are multiple causes. So you deserve comprehensive testing to figure out what's going on with your pain. And then you require a holistic approach and to diagnosis and treatment. So there you have it. Joint pain, super important topic. And I want you all to remember that you could still have hope, that there are answers, and you still have the power to heal. I'm going to end it there. If you do have any questions, put them in the comment section, and I will get to those and try to answer those. But have a wonderful evening and be safe. And I'll see you next week. Take care.